is just absolutely a huge honor today. I can't believe I scored an interview with the executive director of the American Dental Association, Dr. Kathleen O'Loughlin, who is the first woman executive director of the American Dental Association and is Irish. Congratulations on being the first woman executive director. What year did you get that in?
2009.
2009. And when did the ADA start? What year did it start?
I think it's 157 years old.
157 years before they had a first woman. Congratulations on that. How cool was that?
It's very cool. Thank you.
When you walked out of dental school, did you ever think someday you'd be the executive director of the American Dental Association?
I was hoping I'd just graduate, Howard.
Let me read your bio. Dr. Kathleen O'Loughlin of Medford, Massachusetts, became the American Dental Association's Executive Director, Chief Operating Officer, June 1st. Prior to joining the ADA staff, Dr. O'Loughlin worked briefly for United Healthcare as its Chief Dental Officer. After having served as a consultant to Tufts University School of Dental Medicine, Boston, on curriculum development in preparation for expansion of the dental school facility and the Massachusetts College of Pharmacy and Health Sciences, Forsyth School of Dental Hygiene, Boston, in preparation for its 2009 accreditation. She received her dental degree summa cum laude from Tufts in 1981 and a master's degree in public health care management from Harvard. Is it pronounced Harvard or Harvard? Harvard School of Public Health in 1998. She received her bachelor's degree in biology cum laude in 1973 from Boston U. She's the first woman to hold the position of the ADA Executive Director. From 2002 to 2007, Dr. O'Loughlin served as President and Chief Executive Officer of Dental Services of Massachusetts, Inc., Delta Dental of Massachusetts, where through her leadership, the company doubled its reserves, increased membership by 400%, and executed a successful 5-year growth plan. Also during her leadership, Dental Services of Massachusetts made charitable contributions of $53 million, which included endowed professorships at the dental schools at Tufts, Harvard, and Boston U, as well as MCPHS. She is an assistant clinical professor in the Tufts Department of General Dentistry and a member of the Tufts University Board of Trustees. For more than 25 years, Dr. O'Loughlin has been a member of the ADA, the Massachusetts Dental Society, and the East Middlesex District Dental Society. She's a member of both the American and International College of Dentists, the Santa Fe Group, Pierre Fauchard Academy, American Association of Women Dentists, and Tufts University School of Dental Medicine Alumni Association. Dr. O'Loughlin serves on the boards of directors of Oral Health America, Biomedical Science Careers Program at Harvard Medical School, and the Children's Dental Health Project, Washington. Man, what a career. That is just an amazing career. So I got to ask you, the question I'm just dying to ask is, when it comes to bleaching, bonding, root canals, fillings, crowns, you can't get two dentists to agree that it's Wednesday. How the heck do you get 100,000 dentist members? How do you get them to agree on anything?
Well, we have 157,000 active practicing dentists, and we have 177,000 all the way from students to residents to retirees who affiliate with the ADA and claim them as members. So it's a big group, you're right.
And what percent of those would agree that today is Thursday?
Well, at least the 3% or 5% that participate in leadership. They work hard to come to consensus, and they do it because they have a big governance structure, and it's like the Queen Mary. It keeps moving forward, even though it's a little slow at times. But it's a very democratic association, and it's really good that members have every member on their own can have their input heard and people listening.
You know, honestly, I have always been a member since 1983 for basically one reason. I mean, the ADA is kind of like your parents. It doesn't matter if you like your mom and dad or not. They're your mom and dad. And the bottom line is you're pretty much the only voice for dentistry, especially when it comes to all things Washington, D.C. Do you agree with that or not agree?
I think we're the most effective voice for dentistry in Capitol Hill in Washington. And I would say the same for the local lobbying efforts by state associations. They really try hard to protect the public and the members' best interests so for example, you know, if you want to talk about the new regulation section 1557, that came out of the ACA, the Healthcare Reform Act, back in 2000, 10.
Obamacare.
Yeah, and this was a part of the Reform Act that was very good. It was to avoid or eliminate discrimination in healthcare delivery. So health equity is very important. Unfortunately, sometimes the regs, as they come out, are more suitable for the medical environment and produce enormous burdens for medical practices, which are much smaller operations, much less sophisticated. And this in particular could be very onerous, especially for the 42% of our members that participate in Medicaid. If you take federal dollars, Howard, you are responsible for instituting a pretty sophisticated translation service in your practice that would include the top 15 languages in your community and make it more difficult to use family members or neighbors who would normally come into a dental practice and translate on behalf of the patient. And so we're trying very hard to get the government to postpone this reg a bit so we can educate our members, help them be ready to be in compliance. And I think that's the benefit of ADA. Dentists in their practices are totally unaware of this. And yet, as of July 18th, they were supposedly to be in compliance with this new regulation.
Yeah, and people always have told me I've thrown my vote away for 20 years because I always vote. I'm a registered libertarian. And they always ask, why are you throwing your vote away? The next thing out of their mouth is some big government regulation that you have to go down there and fight for. And we hear so many dentists. If I go into any of my friends' dental offices here in Phoenix, Arizona, they got their ADA plaque. I'm a member of the ADA. And a lot of that is because it's perceived by the patient, the ADA seal of approval on toothpaste, what have you, that there's a code of ethics behind that. What would you say is the ADA code of ethics?
The ADA code's evolved over the last 150 years. The AMA has a similar code of ethics, but it's 4 or 5 times the size. So the code is guidelines and kind of guidance for dentists, especially young dentists who are just coming out of dental school, as to what are the things that help them serve the public the best. So things like beneficence, to do good, to avoid doing harm, to treat the patients fairly, to treat them with justice, to fully inform them of risks and benefits so that the patient has autonomy in making their own decision about what they want to do for their own health and what is good for them. I think these are very important in this day and age. I think all dentists need to be respectful of all of these items. And I think because this is the one requirement we ask all members to commit to. That's what makes it so unique. When you become an ADA member, Howard, way back 33 years ago, you actually promised to adhere to these code of ethics, and we think that has tremendous value for our public, the patients. It's kind of like our ADA seal of acceptance for our patients.
That is amazing. I've also thought this. Dentists kind of live in a bubble. They live in their office. There they are in Parsons, Kansas. They're slugging it out every day with their patients and root canals and crowns and dental insurance, all that kind of stuff. But I think 9 times out of 10, they don't even know what it's like a day in the life of you. I wish you would tell. You're talking to thousands of dentists all over the United States. What is it like being a dentist? I mean, you're a homie just like us. What is it like in your job? You're in 211 Chicago Avenue with what, 400 employees? How many employees are you running these days?
About 426. We have about 25, 26 in Washington. That's our government affairs office. And we have about 400 who work on various areas of interest or specialty areas here. So for example, we have a group who work on dental practice issues. We have a group that work on science issues, a group that works on dental accreditation and serves the needs of the commissions that operate, that have been authorized by either the Department of Education of the U.S. government or by the dental boards of every state, who depend on our joint commission to produce national boards to help dentists qualify for licensure in every state. So we serve lots and lots and lots of stakeholders in addition to our members. We have an enormous membership division that focuses on how to best meet member needs. What do they need? What problems are they having? How can we help them solve those problems? And we have a big communications division, as you know, because communicating with 200,000 dentists is not easy. And everyone is barraged by information now. The noise is incredible. And we're trying very hard to customize our message to each individual dentist. So it's what they want to hear, when they want to hear it, provide information they need at their fingertips 24/7. And we're trying to keep up with Google and be more Amazon-like in how we service all our members.
Yeah, and it does. I have to tell you, it does irritate me when you hear when all of us, a huge percentage are paying dues, but then there's a lot of dentists who they find something they didn't like, so that's their excuse to not pay their way. And it also concerns me sometimes with millennials, the younger kids. I mean, I'm a baby boomer, and I only made that by like 2 years. I think if I'd have been like 2 years earlier, I would have missed. I was born in '62. But it's like it's like we're paying all this for long-term investment in our sovereign profession. And then some of these millennials, you hear them say, well, I got $350,000 student loans. I'm not paying dues. And I'm like, dude, you're driving a $30,000 Honda Acura and you went on a cruise on spring break. And, it's like if everybody was fighting the fight, it'd be a lot easier for everyone else. So I call them free riders. And anybody can blow up a bridge. But who can build a bridge? I mean, anybody can look at a bridge and say, well, there's something wrong with that bridge and blow it up. But it takes a lot of people a long time to build a bridge. Do you think do you agree with what I'm saying, that there's a lot of free riders in dentistry because they found something they didn't like?
I hope they feel a little pang of guilt that they're benefiting from all the things that members are paying for. But honestly, Howard, I love the millennials. They're the hope of our profession. There's going to be more of them in the profession in another 10 years than the boomers. We're on our way out, they're on their way in. I think they care deeply about things that are important, the quality of the care they deliver. They care about being great dentists. They want to optimize their use of everything new, technology and materials. They can look to us as the group that tests those materials. We make sure their equipment works. We make sure the materials can be trusted, that they'll last. We can provide CE that helps them be at the best of their best in terms of their career development. We really want to help them be successful throughout their career. And that means things like offering them loan repayment programs like we did last year that help any dentist, including residents, to refinance their student debt at extremely preferable rates. ADA doesn't make a dime off of that. We simply are the conduit to help those kids get to the DRB bank and work on refinancing these horrible loans that they're carrying. We also are career center focused. We're building a career center to help them find jobs, settle in communities where they'll be successful. You don't get this from anyone else. We are the trusted source of science. Who else are they going to trust when it comes to pre-medicating patients or using sealants or prescribing antibiotics for knee replacements? They need us, and we know they need us, and we're hoping that they see the value in that every time they pay their dues.
But don't you think it's not fair to help them refinance their student loans when you don't help the older doctors refinance their alimony payments?
I think
come on, share.
Down, Howard.
So when I talk to millennials, when I talk to them rolling out of school, one of their biggest complaints about the sovereign profession in dentistry is state licensure, taking license. A lot of them say, God, I just graduated from Boston. Why do I need to take a license? And why do I have to take a different test in Kentucky or Arkansas or Alaska? What do you think of the general dental licensure state by state?
Well, it's a pretty fragmented issue. Honestly, our members are calling us complaining that if they're in the military, they're having trouble with their spouses who are dentists to be licensed wherever they're deployed. That's a problem. Retiree dentists want to follow their grandchildren and work part-time for someone else. They're having a problem with licensure. Our dental deans are complaining that it's in the way of faculty recruitment because it's difficult to get licenses in certain states. So we know it's an issue for our members. Millennials move far more often, and we have data on this, than the boomers. They move twice as much over the course of their career, state to state, than we ever did. So we need to be cognizant of the fact that we need to reduce the barriers for these folks so they can go where they need to be. So we're fighting on the issue of licensure portability right now. We're partnering up with ADEA and with the Student Association, ASDA, and we've convened a task force. It's now in its second year. And basically, this is a state-by-state conversation to help state dental boards best fulfill their obligation to protect the public. So we're trying to work with the states to help them ask the right questions, understand what the data says, understand what licensing examination process is most effective. And right now, in 52 different states, because there's Virgin Islands and District of Columbia, we count them as states, there are 52 different pathways to licensure if you look at all the regs and the nuances around the state statutes. So we're trying to make it easier and still help the dental boards fulfill their public responsibility of protecting the public. So more to come, Howard. But right now, there's a portfolio pathway. California's testing that. There is a licensure through a postgraduate year. 2 or 3 states have accepted that. We have licensure with OSCE in Minnesota. ADA is in the process of building its business plan to develop a U.S. OSCE, which is an objective, structured clinical exam that's non-patient based. And we have licensure by credentials in addition to the traditional examinations that you and I took. You know, the REB and CERTA and CETA and the NERB. So we're making progress, but it is an advocacy role that ADA plays. We can't force the states, nor should we force the states to do anything. We need to enlighten, educate, and advocate, and that's exactly what we're doing. I don't know when portability will be universal. I'd like to think it's before I retire from the ADA, and I'm not telling you when that is, Howard.
You know, when you and I in our careers, the big demographic bubble was the baby boomers. And you know, if you looked at a snake swallowing a rabbit, we were the rabbit, this lump going through the snake, and it really changed the dentistry. They wanted their tooth colored fillings, bleaching, bonding, veneers, all that kind of stuff. And now they're going into old age at 10,000 people a day, and that's why we see dental implants exploding. But on the other end of that snake, the millennials had an echo boom in I think it was in 2007 of like 4.5 million kids. And then Obamacare changed the language that health insurance had to start doing. So between that millennial echo boom in 2007, where they had 4.5 million kids, and Obamacare mandating that, children health insurance had to be covered, dental, do you think this is a game changer?
I think ACA was a game changer for kids, and it started actually before ACA. I mean, there were state-by-state expansions of dental care to kids in Medicare through the CHIP program. So I think this has had a tremendous benefit on access to care for children. They are on parity now with kids with private dental benefits. In the states who have raised Medicaid reimbursement levels, their access points are equal to those kids or even superior to those kids in private dental plans. So I think we've solved some of the problem with care for kids. We now have to focus on adults and aging adults. I think the boomers are going to create a huge challenge for the dental profession in terms of accessing care, paying for care, utilizing care. They're accustomed to dental benefits, or they're accustomed to having some employee support for their care. And Medicare, as you know, doesn't provide dental benefits, although you can get them through Medicare Advantage plans. I think the boomers are going to expect a lot more from government and the profession, and we're trying to get our arms around what does that look like, what should it look like. I think it's important that we participate with coalitions that are interested in elder care and dentistry and come up with some creative solutions. You know, a lot of governments at state levels are cash strapped. Their Medicaid dental programs are reversing because they're in budget crisis. We know the feds will want to figure out how do you pay for it if it's offered. And so there's lots of conversation to be had to come up with a good solution. But we really want to make sure that the public feels that they have equity and access to care. And that's really an important driver for us. So again, more to come on that.
I want to ask you, since you're the first woman executive director and you're a dentist, an esteemed dentist, I want to ask you a question because if I opined on it, I have no qualifications. When I graduated, most of the schools are men. I mean, even though I have 4 kids and a granddaughter, the thing I hate the most in dentistry is working on a kid. And I think so many of my male friends that are in their 50s, I mean, the pediatric dentist is their best friend of all the specialists. But do you think now that the dental schools are half women, do you think a lot of those women dentists, because they're women, will actually treat more children in this Obamacare and all that? Do you think because you're a woman, your group will be more likely to treat pediatric dental patients than an all male group?
I don't think we can make any gender assertions like that, Howard, because
Oh, come
women,
on, it's dentistry uncensored. You can say anything you want.
oh no, trust me, I spent a lot of time talking to women dentists.
Yeah?
50% of them are now graduating. The feminization of the profession is here, and it's here to stay, and it's going to continue to go up. The women in dental school is trending up on admissions. So it could be 60% of the profession in another 20 years. I don't think women want to be treated any differently or considered any differently than their male counterparts. They just want to be great dentists. I think women tend to want to participate in caring. They tend to gravitate towards pediatric dentistry. There are more women residents in pediatric dentistry, but there's also a growing number in oral surgery. There's also a growing number of endodontists. I mean, I don't think you can make broad generalizations. We need to watch where women go and how they practice. We know they may have a higher tendency to go into group practices for obvious child caring reasons. It gives them more flexibility. I think women have other interests outside of their dental practice. I also think women like to aggregate practices with other women who share their style, their communication patterns, and their business philosophies. But I think it's too early to make these broad generalizations that women are going to save you men from treating little kids in the future.
Well, you and I did. I mean, when you and I were little, all the OBGYNs were men, and
right?
now they're all women. And
Yep.
in all honesty, I have not met a male pediatric dentist graduate in the last year. Any school I've gone to, when I go into the pediatric program, it's all women. And a lot of pediatric dental instructors have told me it's going just like OBGYN. They say, yeah, there's far more women going into ortho, perio, all that kind of stuff. But a lot of people are saying that pediatric dentistry is going extremely female, extremely fast.
Very well because it's an attractive career path for women. But if you look at veterinarians, they're essentially 100% female now. Most of the vet schools are at least at 80 to 90% female. So I think you're going to see it in a lot of health professions, not just in dentistry. And I think you're right. I think women may gravitate more towards pediatric dentistry, but I'm not sure how long they won't just gravitate to whatever makes them feel, intellectually rewarded.
So you said veterinary was up to what percent women?
Most of the veterinary schools we've spoken with, because we're looking at all the health professions around debt, they are hugely majority proportion women right now. And if you look at the graduating classes, they're trending towards 60 to 80% female in most of the vet schools.
Huh. That is it. I did not know that. What you're a proud member and organizer and board of directors of Oral Health America. I just assume there's a lot of people who have always seen Oral Health America. Everyone knows when you go to the Chicago Midwinter meeting, they always have a big gala dinner and everything. But there's a lot of people who probably don't know exactly what Oral Health America does. Why are you a board of director of that, and what does it do?
I termed out on that board a few years ago, so the bio you have is not exactly up to date, but I served on their board for several years, and I was on their board when they hired their CEO, Beth Truitt. Oral Health America actually is a spin-off of the ADA Foundation from many decades ago. They focus on health equity. They focus on populations who have difficulty accessing health. Right now, their main focus is in 2 areas, children and in the elderly. They have picked up the elderly as a huge issue in oral health care access and delivery. So we work with them very well. We partner up on Give Kids a Smile days. We invite them and they invite us to participate in different events. So we have a nice collegial collaborative relationship. I always attend their phenomenal gala at the Midwinter meeting. It's be there or be square, right, Howard, if you're in industry. And I just have to admire their mission, and I enjoyed my time on their board very, very much and admire them greatly.
I'm jumping all around by different issues. I want to go back to Obamacare. The thing that I thought was I was sad about Obamacare. I know that dentistry is only 5% of the American healthcare budget, but regarding water fluoridation, it's not a state by state issue to vote in or out vitamin D in milk to prevent rickets. It's not a state by state city council's job to decide if we're going to iodize salt and prevent goiter. It's not a state by state city council to decide whether or not we're going to chlorinate the water to stop cholera, which is the #1 cause of death on earth. I mean, I just, Obama could have done so much for dentistry. We said, you know what? The science panel isn't your city council. It's the Centers for Disease Control. It's the World Health Organization. It's the American Dental Association. This is federal law once and for all. I mean, we're always, ever since I graduated, we're right at about 3 out of 4 Americans have fluoridated water. And whenever you put it at a town, some crazy town comes out because God knows it's a communist plot and it was started by Stalin. And we have a U.S. Senator, Joseph McCarthy, YouTube videos where he's on the Senate floor showing a diagram of a brain with the red spot because Moscow fluoridated the water. And when that brain is exposed to fluoridated water, they're more susceptible to communist. I mean, it's just so crazy. Do you think that will ever be federal law?
It's a tough balance between states' rights and federal mandates. You know that. CDC and the ADA have a very good, strong relationship. CDC got more money this year to put towards helping cities and towns upgrade their machinery that does the actual fluoridation. Believe it or not, sometimes it's a simple budget issue that makes the town meeting decide not to fund it. We've had great success in fighting back anti-fluoridationists and their pseudoscience. We provided toolkits for the states. We have done a lot of educating. Our spokespeople are very credible. The science is sound. We've done our evidence reviews. So I'm hopeful that more states will pick it up and make it a mandate. Do I ever think the federal government will pick this up as an issue? I'm not sure. States' rights are states' rights. But we are good partners of CDC, and we did lobby to get them more money to help sustain this effort and provide states with real data, not pseudoscience about the benefits. It is still the #1 public health initiative ever undertaken by this country. And in addition to fluoridated toothpaste, we've seen a massive reduction in dental disease caries in our population, and including populations at risk. So I'd hate to see us not continue to fight that battle.
And the main statistic is that most of the countries that fluoridated their water and were communist are now no longer communist. So it looks like fluoridated water prevents communism. I just want to report to you, I'm in Phoenix, Arizona, and we, 25% of my patients speak Spanish as a primary language. There's big Native American populations out here. And what I just want to report to you from my neck of the woods is that the rich and the middle class all drink bottled water. The people who drink the water, the fluoridated water, are poor. And, when I grew up, we were poor. We drank out of a garden hose. We thought that was refreshing. Man, so water fluoridation greatly impacts the poor. And if you're a rich person and you don't like government or whatever, well, you're already drinking bottled water anyway. You're not drinking out of the hose. But whenever I'm in Phoenix and I see these gardeners at a house and they're drinking out of hose on the lawn, they're filling up these dills with water. The people that drink all the fluoridated water in Phoenix are poor. And that's more likely to not have dental insurance anyway. I mean, I just think it's that one of the greatest public health measures ever. You're also you were also on biomedical science careers at Harvard Medical. Now, is that a stem cell project? I mean, the stems. What is it? Science, technology, engineering, math, or?
I had the privilege of being on the board there for many years. Dr. Joan Reed, who's a physician, faculty member at Harvard Medical School, is the executive of this. It's a pipeline program to get young kids of color and of diverse backgrounds into the health sciences. That includes dentistry, medicine, PhDs, just to get those STEM kids out of science, technology, and math. Get them involved and interested and excited about dental careers and medical careers and science careers. So we had great luck building the dental pipeline group through that. I'm still in touch with a lot of the kids I mentored. It's a mentoring program, and I'm still in touch with a lot of them. I'm very proud of the program that ADA has here with Diversity Institute. We bring in a diverse class every year of 15. It's subsidized with us by Shine. I'm very grateful for that support. We bring them in every year and put them through a mini MBA program, and they go back to their states and end up in leadership because of the toolkit we give them and the training, and we follow them along. We now have 12 years of that classes, and they're having a huge impact in getting kids of color and kids of different ethnicities interested in dentistry, getting them into pre-dental college, into dental school, and then into career pathing after. And Oral Health America has partnered with us on that. Their interns are these pre-matriculation kids, and I'm very proud of one of Oral Health America's interns who's now entering Tufts Dental School next week, I think. So these pipeline development projects work. I was privileged to learn how to do it right at the Career Institute, and I would love to see all of us partner up more on mentoring kids from diverse backgrounds and getting them encouraged and interested in dentistry.
Okay, let's go after some of the more controversial things that get my homies all worked up and crazy. One is dental health therapists. When this started coming out, I was looking at states like Alaska that had areas that didn't have one dentist that was like the size of Rhode Island. And when they started talking about some hygienist getting on a snowmobile and going out and serving some poor person in an Eskimo, it was like all the dentists just went crazy. And I saw it also back in the day. You remember back in the 80s how when some of these states gave hygienists the right to set up their own office. And, 25 years later, there's probably not even 10 hygienists that do it out of 100,000. And every one that I've met is in some town out of 1,000. It's in her own house. She took out her dining room table, put in an operatory. She's cleaning people's house who had no access to care. And if she sees something, she writes a referral note and sends it to a dentist an hour up the street. And that dentist thinks she's the greatest person in the world and sends her cakes and cookies because she's referring all this dentistry. So let's talk about the controversial stuff. Dental health therapist, hygienists owning their office. Why is access to care and availability work dentists up into a frenzy?
I think the different solutions work dentists up into a frenzy, not the issue. We all want to solve the issue. I'm not so sure that spending a lot of resources on a brand new model of delivery is going to get us the solution we want or the result we want. I'm always frustrated by the lack of data around any of these models that show their effectiveness in solving the problem they were established to solve. So that's just one issue. Honestly, we think there's more opportunity for collaboration towards getting better results through other strategies. So for one, we know navigators in poor communities, formatoras, are far more effective in getting people into care and accepting recommendations. I mean, you brought up Hispanic culture. Many people from Latin America are very suspicious of public water, Howard, because they couldn't drink it back in their native country. So a person from their community that can help them navigate the healthcare system, get them an appointment, make sure they don't break an appointment, help them sign up for Medicaid if that's what they need to do, help them get to a community health center if that's where they can get the best care. We think that is important. So we launched that Community Dental Health Coordinator project years ago. It's getting traction, especially among the tribal nations. The Navajos in particular are very excited about this model. We help them in their development of a 10-year oral health plan, and we think that's going to get a better result than fighting for the next 10 years over a new workforce model. In addition, we think that getting kids interested in rural areas and giving them incentives to land in rural areas and stay there. We've worked hard to help the HHS up the reward for tuition abatement when you choose to work in a community health center. So we want to solve the same problem. We just want to solve it in different ways, multiple ways. Getting patients out of the emergency room. There are a number of successful pilots that could be scaled up very easily, that get patients out of the emergency room as a dental home and get them into regular, consistent care with subsidies or a price point they can afford, or utilizing, Medicare, Medicaid benefits that they're eligible for. So we just think we want to solve the same problems. We just have different thoughts about easier solutions that would get better results faster. And we need to measure. We need to figure out what is working, what's not working, and get together on consolidating the approach.
Well, if you have any emergency room models or someone that could podcast talk about that or whatever, I would love to be introduced, because in Arizona, 6 to 8% of all emergency room visits are dental related.
We could put together a great discussion for you on successful models. The one in Grand Rapids, Michigan is probably the one I know best, but we'll put you in touch with the experts, and you'd have a good time listening to them. Very creative, very innovative solutions that are really working and saving the hospital system a ton of money while getting better health outcomes.
And
So
Grand Rapids, Michigan was the first city in the United States to adjust the fluoride in the water. And what was it, January 25th, 1945 or 1940, something like that, 1945?
Innovative group there.
Yeah, that is a, yeah, and you're right about Hispanics coming here and not wanting to drink the fluoridated water. You're exactly right. When I was in Africa, when I was in Soweto, Tanzania, Ethiopia, it's all the doctors telling the moms, only let your kid drink Coke, because with a can of Coke, they don't have to worry about cholera and disease. And then all these dentists are out there saying, well, it's causing decay, obesity, and diabetes. And it's like, well, decay and obesity and diabetes is a hell of a lot better than dying of cholera.
Yeah, and you're absolutely right. Prevention is key. We can't put enough resources into treating active disease. We don't have enough money or time or anything else. So we have to get to prevention early, which is pregnant women, young moms, young children. Get it, sealant programs in the school, get sealant programs to be ubiquitous, to make dental screenings or dental exams an important part of getting ready for kindergarten readiness. There's a whole lot of public policy we could do that would help us eliminate disease before you have to put a kid in the operating room.
Okay, now can I tell you my two biggest pet peeves in all of dentistry?
Sure.
Okay, so here's what gets me almost to stroke level, blowing a vessel in my brain. So when you look at the 8,000 to 38,000 Americans that die each year from the flu, depending on the year, usually the first, second, or third last entry point into the U.S. healthcare system was at the dentist. And I am not allowed to offer grandma and grandpa a flu shot. Either is my hygienist with a 4-year degree. But if they go to Walgreens and CVS, a farm tech, not even a pharmacist, a farm tech 9-month program can give grandma the flu shot. Then here's all my homies measuring grandma's gum disease and making sure she doesn't have a cavity or gingivitis. Then 3 weeks later, she dies of the flu. And it's like, are you a doctor or are you a tooth mechanic? You just had grandma in there, and the most likely thing she was going to die of before her next 6-month recall during the winter would have been the flu. Why don't all 50 states tell them the dentist? And the same thing with oral cancer. When we were little, oral cancer was all smoking and drinking. Now they're saying HPV. And I can't give, that's my department, head and neck. I can't give an HPV vaccine. I can't even talk about it to the patient. But then go to Walgreens, and somebody who's 19 years old, who just finished a 9-month program of school, can give them an HPV shot and a flu shot. And that just ain't right.
Well, we share your frustration. So we know we need to be more intercollaborative between the professions, because I could tell you dentistry could be a huge part of the primary care system. I think the scope of practice issues are a state-by-state regulatory issue that could be addressed. So I support you. I think dentists should do as much as they were trained to do, up to the top of their license, which does include, by the way, screening for basic medical illnesses. Most dental students today learn how to take blood pressures, screen for A1C levels. They certainly know about HPV, and they certainly are experts by the time they've given 1,000 injections to give an injection. So I think this area holds great promise, and I think the ADA agrees with you, Howard. Dentists are far more qualified than people give them credit for to be a real important part of the primary healthcare system. So I would encourage everyone to look into it, and in those states that have an appropriate scope of practice, start incorporating it into your dental practice, and we can help you. We have resources to help you.
And so let's go back to how I started this deal. I mean, all the dentists listening to you right now, podcasting is a multitasking behavior. They're all 30 and under, by the way. Probably almost every email I get to howard@dentaltown.com, they're either in dental school or they're under 30. And whenever I'm at a bar with a bunch of 50, 60-year-old dentists, they've never even listened to a single podcast. Every single email I get is, they're young. And so they're driving to work, they're multitasking, they're, instead of the radio, podcasting is killing, it's crushing radio. So, they turn on the radio, it's all commercials, it's all talk. And I think it's exploded right now because they're so sick of listening to politics. Whenever you're in an election cycle, I don't think anybody in America wants to hear another thing about the election until it's passed. But go back to, they're driving to work. They know what their day's like. What's your day like? What's it like being a dentist as the executive director at ADA? What's your 8 to 5 look like?
Drive 6 to 9.
6 a.m. to 9 p.m.?
6 days a week, 7 days a week. Yeah, it's busy, but you know what? Every time I meet a dentist, I fall in love with dentistry all over again. I love talking to them. That's the one thing I get to do. I get to meet thousands of dentists every year. I travel all over the country with the officers. Our House of Delegates has a couple of thousand people. There's, at any given point in time, we have 3,000 dentists participating in their association. I get to go to state associations. I get to go to dental schools. I get to talk to the deans. I feel like I have the luckiest job on earth. I am blessed. It's amazing how much I have learned over the last 7 years about how great dentists are and how proud I am of being part of this profession. I got to tell you, when I was just coming out of dental school, the joke was, if you didn't get into medical school, try dental. Now it's reversed. Now if you can't get into dental school, oh gee, I guess I'll have to apply to medical school. So I think we are heading towards a great, great future. I can't tell you how impressed I am with the young leadership. These kids are smart, they're networked, they're well informed, they're far more well-traveled than we ever were, they're far more culturally sensitive. I get so excited when I come back from an ASTA meeting with 2,000 dental students that I don't mind getting up at 5 o'clock every morning and driving an hour and a half into work. I don't mind when I get angry members who call me up and ask me why I can't, fix a podcast, or why I can't fix Groupon, or, why I can't make dental insurances pay more. So honestly, I think we're headed for a really great future. We are now graduating the largest class of dentists in the last 25 years, 6,000 of them. That's when you and I graduated, Howard. And then it dipped down to 4,000 for about a decade or more. So I am very hopeful for the future, and that's why I love this job. I have fallen in love with dentistry all over again after getting a little disenchanted and burnt out after practicing for 25 years. So I'm getting to live my second career.
That is awesome. And I'll tell you what you tell them when they call about the insurance complaints, because I know they want to blame everything on insurance, okay? And I've lectured in 6 continents. And the bottom line is, you go to Singapore, there's no such thing as dental insurance in Singapore. You go across the water there in Tokyo, and there is dental insurance. So Singapore has water fluoridation and no dental insurance. Tokyo has dental insurance and no water fluoridation. And the bottom line is, nobody around the world has phone insurance to buy an iPhone or plane tickets to go to Wally World or Disneyland. And when the dentists blame everything on insurance because they're too chicken to learn how to sell dentistry directly to the patient for cash. And when you and I got out of school, every dentist in the UK was part of the NIH. And right now, for a root canal fee from the government in Paris, London, and Tokyo, it's down to $100. And now when you go to the UK, 5,000 dentists said, you know what? I'm not doing a root canal for $100. I'm no longer participating. And they're going out asking for cash, the same cash you bought your iPhone with, your new pair of shoes, your new tennis shoes, your high heels, your fancy dinner. And I think it's an absolute, I think when dentists blame all their problems on insurance, I say, go to Brazil, go to Russia, go to India. You know, when you go to China and have you ever talked to a Chinese dentist about dental insurance? They're sitting there painfully. Their eyebrows are crinking, and they're like, well, if you don't brush and floss, and you drink Coca-Cola and eat Hershey bar, why would your boss pay for your cavity? And it's like, I know, dude, it makes no sense. Why would your government? And then they sit there and tell you that that's a reverse incentive, that you wouldn't want to incentivize or subsidize dental decay if it's a preventable disease that's caused from eating sugar and not brushing and floss. I mean, I'm fat. I'm 50 pounds overweight. I haven't had a cavity in 30 years. I brush and floss every morning. I brush and floss every night. So these dentists sit there and blame everything on Delta, Blue Cross, United Concordia, whatever. Then just say, well, then man up and throw it away. There's no dental insurance in Singapore. There's none in Russia, Brazil, India, or China. You'll never be able to explain dental insurance to a Chinese dentist the rest of your life, because that's how little sense it even makes that your employer or your governor or your president would subsidize the fact that you don't know how to brush your teeth. But don't get me started. So what what other issues is it like being today? Like what are you seeing in the field? I know on Dental Town, they're always complaining about dental insurance companies, and they're also very complaining about corporate dentistry. They think corporate dentistry, and that's another thing I don't understand. So can I rant for just a minute on corporate dentistry? I mean, I don't want to take away time from the executive director of the American Dental Association, but look at corporate dentistry. They say how bad it is, but when these kids come out of school, they're the ones offering him jobs. Those are our sovereign professional colleagues. I'm like, okay, well, man up, Larry. You're complaining about Heartland. Well, are you offering a job for an associate straight out of school? They go, no, I wouldn't hire anybody until they have 5 years experience. Okay, well, if Heartland and Pacific are giving them 5 years experience, they're your ally. And then when they get old enough to retire and they want to sell their office for $1 million cash tomorrow, well, Heartland will just show up on a unicorn and write you a check. These dental students come out with $350,000. So it's kind of like, you know, they whine, but I don't know. I think corporate dentistry, if you measure a corporation with having 50 offices or more, they're probably only 12 to 14% of the market. They're offering jobs for the young, liquidity for the old. So tackle those two monsters. What was in that Godzilla? Who did Godzilla fight? Who? King Kong. So if the evil Godzilla and King Kong are corporate dentistry and dental insurance, what are your thoughts on those two controversial subjects?
One at a time, because they're both very different. So, you know, Delta Dental way back in the 60s was actually an ADA initiative, believe it or not. And it was the biggest boon to dentistry ever. So for about 40 years, patients with a dental benefit started going to the dentist at much higher rates than previously, before the advent of dental benefits. It was a great way for employers to attract and retain employees. So for 30, 40 years, it worked great, right? Now it doesn't work so great. Inflation has eaten away at the benefit. The maximums have never been lifted, and that's been an employer decision. The benefit design hasn't kept up with prevention and technology and the way dentists are trained now. So it needs major reform. And I would think most people would agree with me, either privately or publicly, that it's time for major reform in the dental payment system in this country. Marko Vujicic of our Health Policy Resource Institute has put out a lot of interesting papers regarding real benefit. And for many people, paying the premium is actually more expensive for them than just going for preventive care. I think people have to do the economic analysis. They have to look at the benefit, understand the benefit. We can help people analyze their benefits and see the true value in it. But it's really time for industry to take a hard look at the model. And maybe ACA will help move that along a little faster. We're talking about bundled payments now. We're talking about paying for outcomes, paying for value. Our dentists aren't ready for that. The dental insurance companies aren't ready for that. And our patients aren't ready for that. But that is coming on the medical side. So we got a lot of work to do. I'd like to think we work with the payers to come up with better solutions rather than to be Godzilla and King Kong fighting it out to the death. But there's a lot of work that needs to be done, and our councils here are starting to move in that direction.
How do you say Marco's last name? I'm his biggest fan. Vujicic? Vujicic?
Yeah.
I've been trying to score. He was like the first guy I asked to be on a podcast. This is podcast 508. I love that guy. I love his videos. What does lattes, lawyers, and dentists have in common? I mean, he's not only the greatest economist in dentistry. I mean, he's might be the only one. I mean, he's amazing. Will you tell him? I don't know if I'm in his spam filter. He's probably so intelligent. I'm in his spam filter. But will you tell him I'm dying to podcast that guy?
I'll speak to him personally. How's that?
Yeah, and at least he could do is just come on the show and teach me how to pronounce his last name. Vujicic?
Yes, he's a very proud Toronto native, Serbian descent.
Toronto native. Well, that don't even make sense if he's Canadian because they support hockey, which knocks out teeth. How does he wrestle his Canadian anti-teeth heritage?
Howard, let me pivot back to the large dental practice models. Our job isn't to defend one model over another, right? Most of our traditional members have been solo practitioners or small groups, 1 to 5 to 10 dentists. We know this market of consolidated practices, however they're organized from a business perspective, whether they're supported or whatever, is growing, and it's growing fast for all the market reasons you've already talked about. Women, the rate of payment, the level of payment, the cost of technology, the lack of demand, the need to market more aggressively, all of these external market forces are the reason why they're growing so fast. And I don't have a magic wand that can make things stop that dentists don't like because they feel threatened. Now, having said that, I owe it to all of my members to do the best I can to help them succeed. So that means providing support for the solo practitioner who may be the bulk of the boomers. It means providing practice support for those dentists who are beginning to aggregate, the millennials and the Xers and Ys. They're starting to aggregate on their own. There's a practice in Virginia that is now up to over 99 docs, and they're not DSO supported. They're just doing it on their own because of market forces. It gives you better negotiating club with dental payers when you have a bigger group, right? So honestly, we're trying to educate our members about how to compete successfully no matter what your business model is. And if dentists are interested in aggregating practices, we want to help them because honestly, we think that model is going to continue to gain speed. We think dental infrastructure is too expensive now to have it sit 3 out of 5, 7 days empty and idle. I mean, we're filming from the ADA clinical setting. I know what it costs to build an office because we built one here. It's $500,000 for a single chair. And on top of $300,000 in debt, and on top of weak demand, on top of low dental reimbursement, doesn't it make more sense for dentists to pool resources and work in larger groups to economize, to gain efficiencies, and to keep their cost structure down and keep their busyness up and keep their volume up? So we want to help dentists be successful, but we also have to look out for those docs in our boomer group who were the 1 doc, 5 staff model, while we help the kids who are joining Pacific Dental and Heartland and Great Expressions, help them be successful as well and not feel like they're isolated or disrespected because of their career choice. And by the way, we surveyed those kids. One of the papers Marco wrote was they ultimately want to own. But I don't think their ownership model will look like the one the boomers had in 1980, to be honest with you. I think it's going to be millennials like working in teams, and I think we're going to see more of that. So ADA is here to help them, not tell them what model to be in.
Well, tell Marco I'll even buy him tickets to the Phoenix Coyotes hockey team.
You might get him to do a podcast if you do that. He's
my God. I'm his biggest fan. I really do. I got my MBA from Arizona State University. He's a PhD economist. He's the real deal. I'm just an amateur, but I read his stuff from you guys, and it's truly amazing. Tip my hat.
You get him Wayne Gretzky's autograph on a puck, you'll get them.
Wayne Gretzky lives in Phoenix.
I know he does.
Yeah, yeah. Hey, you know what? I tell dentists that the American Dental Association shouldn't be a remote control. And what I mean by that is, you get your remote control. I've never been in anyone's house where anybody knows how to run it, even though they're all dentists and periodontists and us, because in a remote control, every committee is trying to go and get their buttons on, and every little department and team, and it's horrible. But companies like Google and Apple got all their engineers on the same page to build an iPhone and Google by saying, look, I don't care about your department. The customer comes first. And when we're all disagreeing, what's best for the customer? So whether they need dental insurance, Medicaid, group practice, extended hours, it doesn't make any sense in 168 hours in a week that you're open 32 because you don't know when Shirley's going to have a toothache. I mean, it should be there for Shirley. I go in some of these group practices and you call them up and they say, oh, well, you're Howard's patient and right now Kathleen's working. You need to come in and no. This is a dental office for the patient. The patient doesn't care if Kathleen pulls her tooth or Howard does. They got a toothache and want to see a dentist. And that's what I tell people about the ADA is that, the patient comes first. What's best for the patient? I don't care what silo you're coming from. All that kind of stuff. So I'm just curious, you work on 211 Chicago Avenue, especially approximately how many $100 bills a week do you spend on Miracle Mile?
On what?
Miracle Mile?
I don't.
What's that shopping street called? Is it Miracle Mile or Magnificent Mile?
It takes a miracle to buy anything on the Magnificent Mile. It's a high-end shopping district. But when this building was built in 1960, I don't know, 2 or 3, when Harold Hillenbrand had my job, this was not a place you would hang out at night.
Oh, really?
It's transformed over the last several, decades. We're very lucky to be here. We love it. The employees love it. And I love that when dentists come to visit Chicago, that they can come and visit and feel very proud of what their membership built over the years. So welcome, come visit, 211 East Chicago.
Well, hey, I got to tell you, I know a lot of dentists from a lot of places, been around a long time, and I have heard nothing but great things about you. There are so many people that say that you are the greatest executive director they've ever had. I mean, I've heard that by so many unsolicited people, and I tell them all that's because you're Irish, and I hope they believe me. But really, I just hear. Everybody tells me that you're just an amazing executive director. I've been told you're the best executive director they ever had. You're just an amazing person, and I'm just humbled and honored that you spent an hour today with me and all my homies. And if you ever want to come back or if something ever comes up where you want to talk to a bunch of dentists while they're commuting to work, call me back up. If you can deliver that economist Mark Vujicic, did I say right?
Vujicic.
What is it?
Vujicic.
Vujicic.
Down phonetically, okay?
How about we just call him Fuji
We
from
call him Marco.
Marco. There we go. Marco. Tell Marco I love his YouTube videos. I love all the stuff he does, and I think dentists just eat that stuff up. Hey, again, Kathleen, seriously, it's an honor and a privilege that you came on my show today. Thank you for all that you do for dentistry, and I hope you have a rocking great day.
You're always fun to be with, so thank you for this opportunity.
Well, since we're both Irish, next time I'm in town, can we go have a Jameson on Magnificent Mile?
If you come on March 17th, sure.
Okay. I'll be there.
All right.
Have a good day.
Yep. Bye.